Hi everyone, this is Dr. Fox, and let's kick off the learning objectives for this session with an overview of autonomics. In this video, we'll discuss the basic divisions of the autonomic nervous system and their structures. So the autonomic nervous system is the portion of the nervous system responsible for the innervation of various viscera. So a lot of responses that are automatic, that are completely outside the realm of conscious sensation that we want to regulate, such as heart rate, rate of respiration, what we're doing with glucose, etc., all fall under the purview of the autonomic nervous system. Now, this system is rather elegant. There are two basic divisions, the sympathetic division and the parasympathetic division of the autonomic nervous system. The targets of the ANS are nearly all antagonistically innervated by the sympathetic and parasympathetic divisions. So for instance, the sympathetic division may increase heart rate, and the parasympathetic division may decrease heart rate. Now, each of these divisions serve their various visceral target tissues via visceral motor fibers. These visceral motor fibers are generally arranged in a chain. So there are preganglionic fibers which synapse with postganglionic fibers within ganglia. And those postganglionic fibers then are going to innervate the target tissue. There are also visceral sensory fibers, which aren't technically autonomic fibers, but they're going to transmit back afferent information to the central nervous system from the target. So over here we have a rather elegant schematic to kind of show how the visceral motor fibers may work. So in red we have the sympathetic, and in blue we have the parasympathetic. And so let's just take a look at what's happening with the heart. Heart is predominantly intrinsically regulated with respect to heart rate, but there is extrinsic control from the autonomic nervous system. So looking at the thoracic spine, we can see several preganglionic fibers extending from the thoracic spine to the sympathetic trunk. And it's here in a series of sympathetic ganglia that those short preganglionic fibers are going to synapse with longer postganglionic fibers, which will go out and affect heart rate extrinsically by acting upon the SA node. We also have contributions from the parasympathetic, in this case from cranial nerve 10, or the vagus nerve, shown here in blue. Parasympathetics have very long preganglionic fibers that synapse with postganglionic fibers, generally within the walls of target viscera. So they have very, very short postganglionic fibers, as we'll see. Now, the sympathetic division, we oftentimes call the fight or flight response because a lot of the effects of sympathetic stimulation are those which would be preparing an individual either for a fight or to flee from a fight. Whereas the parasympathetic division is the rest and digest division. Doing all those things that would be quite the opposite of engaging in or fleeing from a fight, as we'll see. So let's take a look at these two divisions side by side, just as a very high-level overview. So the fight or flight response of the sympathetic division is often referred to as the adrenergic response. And that's because the postganglionic fibers secrete norepinephrine, aka adrenaline. Sympathetic division, as I've mentioned, has very short preganglionic fibers and very long postganglionic fibers, which are secreting that norepinephrine. The parasympathetic division, that rest and digest, is often known as the cholinergic response because its postganglionic fibers secrete acetylcholine. In fact, all preganglionic fibers, whether they are sympathetic or parasympathetic, secrete acetylcholine as well. So that parasympathetic division has very, very long preganglionic fibers, and these tend to synapse with short postganglionic fibers within the walls of target organs. Let's just quickly review some of the responses that would be sympathetic versus parasympathetic. So in terms of heart and respiratory rate, sympathetic stimulation, fight or flight, will increase heart and respiratory rate, whereas parasympathetic will decrease heart and respiratory rate. Sympathetic stimulation is going to relax the smooth muscle of the conductive pathways of the respiratory tract. This is known as bronchodilation, whereas parasympathetic stimulation is going to constrict that smooth muscle, leading to bronchoconstriction. So if someone has severe allergies, they may carry an EpiPen, epinephrine, so as to mimic that adrenergic response, so as to bronchodilate in case of exposure to that allergen. Sympathetic stimulation is going to increase the concentration of blood glucose, whereas parasympathetic division is going to decrease the concentration of blood glucose by storing that glucose as glycogen in the liver. The sympathetic division is going to dilate the pupils so as to let more light in, so it innervates the dilator pupillae muscles, which are intraocular muscles, whereas the parasympathetic division constricts the pupils because it innervates the constrictor pupillae muscles. So if you're looking within a person's eyes and their pupils are dilated, they're probably more agitated. If they are constricted, they're probably a little more relaxed. The sympathetic division is going to have a constriction effect on muscles of the arteries, so that's known as vasoconstriction, whereas the parasympathetic stimulation will relax that smooth muscle of the arteries, which leads to vasodilation generally throughout the body. Sympathetic division will relax the smooth muscle of the wall of the gut tube or the alimentary canal, whereas the parasympathetic stimulation will constrict the smooth muscle of the wall of the gut, causing for movement of materials through the gut tube or the alimentary canal. And then finally, an example of imbalance between these two divisions. The sympathetic division is the only one of the two which innervates sudoriferous or sweat glands, and its stimulation causes these sudoriferous or sweat glands to secrete. So when you're sympathetically stimulated, that leads to more sweating. And that's very congruent with a fight or flight response. So let's take a look at these two divisions in terms of a very high level structure. So that parasympathetic or the rest and digest is also known as the craniosacral outflow. So cranio, because the brain stem is going to give rise to 4 specific cranial nerves. Cranial nerves 3, the oculomotor nerve, cranial nerve 7, 9, the glossopharyngeal nerve, and 10, the vagus nerve. And of these 4, the vagus is probably the most significant for our study of anatomy, as we'll see. So 3 of these 4 nerves, 3, 7, and 10, are all going to serve preganglionic parasympathetic fibers to ganglia in the head. 3 is going to ultimately serve intraocular muscles and intraocular vasculature. 7, the facial nerve, is going to serve the lacrimal glands as well as glands within the nasal cavity and major salivary glands, including the sublingual gland and the submandibular gland. Whereas 9, the glossopharyngeal nerve, is going to serve the other major salivary gland, the parotid gland. The vagus nerve serves no targets in the head, but it does serve very many targets parasympathetically in the neck and the thorax and the abdominal cavity. In addition to the cranial contributions of the craniosacral outflow, there's also the sacral contributions. The sacral contributions are the pelvic splanchnic nerves. Splanchnic means viscera. And these are nerves which arise from ventral primary rami, or VPR, from sacral nerves 2, 3, 4. So that's the sacral side of the craniosacral output. The sympathetic division, the fight or flight response, is oftentimes referred to as the thoracolumbar output, and we'll see why in a second. This is very neatly organized in bilaterally paired sympathetic trunks, which largely consist of sympathetic ganglia strung together by fibers, which we can see located anterolaterally to the vertebral column. These trunks run the entire length of the spinal cord and vertebral column and beyond, as we'll see. So we can't see the cervical sympathetic trunks here, but we can see the thoracic trunks, the lumbar trunks, the sacral trunks, all the way down to where they join at the ganglion impar, just anterior to the coccyx. Now we say that this is the thoracolumbar output as opposed to the craniosacral output because the preganglionic fibers are all traveling from the spinal cord to the sympathetic trunk via white rami communicantes. So rami are branches, communicantes are communicating. So white communicating branches at the levels of T1 through L2. So that's about there to there. What that means is the only connection between the spinal cord and the sympathetic trunks are between T1 to L2, and that's going to be significant because there will be no inputs to the trunks above the level of T1 or below the level of L2. Now, at every spinal nerve level, there will be postganglionic fibers returning back to that spinal nerve from the trunk via gray rami communicantes. So from the superior cervical ganglion at the superiormost part of the sympathetic trunks to the ganglion impar at the inferiormost part of the sympathetic trunk, we have postganglionic fibers returning to each spinal nerve. It's important to note that the head is served exclusively from postganglionic fibers arising from the superior cervical ganglia. And they're going to distribute along major vascular pathways, so external and internal carotid, that are surrounded by these perivascular plexuses, which are meshworks of fibers on the way out to target tissues. So we've discussed the autonomic nervous system generally, as well as its constituent divisions, the parasympathetic and sympathetic division. We'll give you more details in videos to follow. This is your summary slide. Thank you so very much for your time.